If there is no struggle, there is no progress. Frederick Douglass. I am keenly aware of the significance of this moment. I am a reflection of so many people who have woven their personal threads into my life. This fabric you see allows me to occupy this space. My formative years were spent in Compton, California. Compton is a place that allowed me to gather testimony, as DeWitt would say. Some things are just incredible. Compton is located a few miles from South Central Los Angeles. And in 1974, it had the highest crime per capita in the nation. That was the year I graduated from high school. During that same time, Martin Luther King Jr. Hospital was constructed, not far from my house. It became a progressive hospital and cared for the underserved patients. There wasn't another hospital in the area for 20 miles. Even still, healthcare disparities abound. Recently, a Hispanic woman called 911 from the lobby of the hospital. She subsequently died from a perforated bowel. After that, the hospital closed. I remember the health issues of my neighbors in the community, especially the one across the street, who was treated for years for diarrhea with a tablet, which later turned out to be colon cancer. With so many similar stories, it became clear to me that health outcomes and treatments were separate and unequal. So then as now, I wove the threads of the desire to reduce healthcare disparities and inequities. Every face was a thread. Aunt Fanny, Mrs. Littlefield, Mrs. Linda Puckett, David Bynum, my brother, Roosevelt Tolbert, and so on. I was fortunate enough to be distracted in Compton, to run track and attend junior college while still in high school. It kept me academically on point. It was actually divine intervention in the person of a Dr. Wilbur Jordan at UCLA, who tore up my original match list and said, with these grades and board scores, you belong at Mass General Hospital. And so it happened. Thank you, Dr. Jordan. I don't know where you are. However, after arriving at MGH in internal medicine, there was a disconnect between my work and my original purpose of giving back and helping the underserved. So impressed was I by this compelling intellectual environment, the researchers, the clinicians, the prestige, the MGH CPCs, and yes, the New England Journal of Medicine. I fell into a trap. My values were rearranged. I didn't recognize it until I had an adverse medical outcome that shook me up. I was tested, and I failed the test of humility. I learned the hard way what St. Paul meant when he urged his followers to heed their personal calling, but to do so with humility, patience, and love for their fellow human beings. Ever since then, I have measured myself by the degree to which I followed this directive. From Luke, to whom much is given, much is required. We're all here tonight because we heard and followed the same calling, to heal our fellow human beings in their time of need. It's a powerful calling with great responsibilities that we must temper with humility and patience. When we serve our patients trying to relieve them of disease and restore them back to health, that is our greatest achievement. Tonight, we are very fortunate to have with us a South Shore Hospital patient who had an incredibly serious illness. All her organ systems had failed. She needed life support. She couldn't even maintain her own blood pressure. But thanks to teamwork and the grace of God, Elizabeth Furtazio is here tonight. One thing she told me to say is, when you saved my life, you saved my two boys as well. Elizabeth and Seth, please stand. And it's really interesting. I know what Seth looks like because Seth has never changed, but Elizabeth was very different back then, and she's gorgeous tonight. Thank you so much for coming. The diversity of talents within the Massachusetts Medical Society gives us an endless opportunity to build consensus around any change in healthcare because we share a common thread. The common thread will permit us to advocate for our patients while addressing healthcare reform, liability reform, practice viability, and even physician workforce challenges. We're scientists. We love data. And there aren't many people who love data more than I do. But we are also servants. We do the right thing when we serve our patients, first and foremost. No other profession in the world combines these two imperatives, science and service, balanced together. We struggle when one side of the equation becomes too important at the expense of the other. When there's too much to scientists, we lose the connection with that person we're trying to help. When we're too much the servant, we fail to use the rigor and knowledge that we trained for. When there's a just balance, life works. Likewise, the same is true for this community of individuals and physicians, for this medical society. There is science to what we do and also service. But it's even more complex than that. We have known for a long time that we must balance our service to both physicians and patients. We have challenges ahead. We have some difficult decisions to make and a lot of conversations to have with each other, with our patients, with the community at large. We are men and women of privilege, and not because of our material blessings. We are men and women of privilege because of what we are doing and what we are called to do. There is no greater privilege in life than to be in the right place at the right time, doing the right thing. We will never go wrong. We will never go wrong if we remain humble and patient and follow the calling that brought us here tonight. Ladies and gentlemen, Massachusetts Medical Society, I thank you for the privilege of serving you for the next year. I will do my best, and I will always endeavor to serve you. I can't wait to begin. Thank you.